So today we're talking about B12. B12, as you're going to find out, is involved in many different um, parts of our body and our health, and is really very essential for life. And I want to just take a moment and introduce our panel of doctors here today. I'm Dr. Molly Force. I'm the clinical director here at Prosper Natural Health here in Port Townsend. And we've got Dr. Rosalie with us and Dr. Mary. And we offer a team care approach to naturopathic medicine, which is essentially like primary care medicine with a holistic approach. Dr. Rosalie comes with an extra degree that allows her to practice Ayurvedic medicine, which is East Indian traditional medicine. And Dr. Mary comes with an extra degree in acupuncture and Chinese herbs. So we really like that blending of the East meets West in regards to our natural medicines. And we really try to provide our patients with a holistic approach. We like to do these clinical spotlights, these doc talks, to really help you all here in our community have more information and be really engaged in recent topics that are coming up, recent medical topics. So this is a big topic we get a lot. We do B12 injections and give B12 supplements in our clinic, and we get a lot of questions about which one is right for different people and why it's so very important. So today we're hoping to really address how common B12 deficiencies are, what type of B12 might be good for a certain person or a certain situation. And then we also want to talk about these B12 shots, which many of you might have heard about. There's, some hype out there about those because they can really make a big difference for some people. So let's just jump into some of the physiology about what B12 is and why it's so important. So what we're going to find out about this vitamin is that it's called a cofactor, which means it's involved in several biochemical processes. Without it, these processes cannot continue. So it's a requirement for a lot of these chemical changes, these chemical chain reactions to occur. We see this really affecting our brain and our nervous system. And we started with this on top because it might be the number one piece that B12 is touted to help with. We know that it helps maintain those myelin sheaths on our nerves. We also know that B12 is essential for our red blood health. Now, our red blood cells are going to help us transport oxygen around in our body. So B12 actually helps with the size, that shape of those red blood cells, and it's involved in this synthesis of hemoglobin, which is part of that transport process that the red blood cells go through. And then it helps prevent anemia. So there's a very specific type of anemia, category of anemia, that's totally all involved in B12 deficiencies. We also know that B12 is critical for DNA synthesis. And this is a big deal, right? Because it's what we need to make new cells in our body. And we also know that fetal development requires B12 in combination with folate. These prevent neural tube defects. Well, the neural tube is what helps us shape our brain and our entire nervous system. So that's a huge deal. B12 also is critical for our energy production. We know that it helps with this creation of energy from both fats and proteins. Additionally, B12 is involved with inflammation, inflammatory processes, and oxidative stress. And even we know that without B12, we have an increased susceptibility to certain infections. We also know B12 is involved in our gut microbiome and the modulation of that. So that can impact us vastly in regards to our immune system, our metabolism, our hormone systems. It's pretty impactful. And then we also know that B12 can be involved directly in the immune system in regards to our CD4 and CD8 cells and our natural killer cells. So suffice this to say, B12 is a big deal in regards to immune response, nervous system response, DNA synthesis, how we're created from an embryonic state. And then another big piece, and you can see this on this little chemical wheel over here, is that our B12 is involved in this methylation pathway. And when we think of methylation, it's kind of a chemical terminology for detoxification of these free radicals. And those free radicals are what do damage, increase inflammation, increase cellular aging and degradation, breakdown. So here we can see that B12 and in addition to folate are critical in this reducing pathway that helps us get rid of free radicals. So it is one of our very, very critical cofactors for dealing with chemical toxins, as well as exogenous, so outside of our body toxins that we become in contact with. So we're going to get into a little bit more of that here during our presentation, but this is just a nice little overview of why B12 is so critical.
Thanks, Dr. Molly. So that's a lot of stuff that B12 is involved in. And I think, you know, when we think about B12 deficiency, we have all sorts of different symptoms that can come up because wow, it just started hailing here. So I apologize for the thunder and the hail, but you can imagine with B12 deficiency that all sorts of body processes are affected. So we have to test for B12 status in more than just one way. And oftentimes I see this mistake get done in blood work, in routine blood work, where a doctor is just checking serum B12. So a blood test that looks at just what is the B12 content of the blood. Unfortunately, this reflects only your dietary intake. So it just tells us, well, you had a recent meal with B12, or it reflects that, oh, you took your B12 supplement recently. Or if you've been doing B12 shots, oh, look how much, is in the blood. It's ultimately just that test in isolation has a poor sensitivity and a poor specificity for detection of B12 deficiency. It can be artificially high. And I see this commonly with patients who are symptomatic with B12 deficiency, but their blood tests come back as high or even high normal because they've been supplementing. It's really important that we do more than one blood test to check for B12 status. Looking at the CBC tells us about our red blood cells and the size of the red blood cells. And like Dr. Molly mentioned, that size clues us in to whether there's iron deficiency going on or a B12 folate deficiency, right? Another factor we can look at is something known as methylmalonic acid, which can be a blood test or a urine test. It's one of the enzymes that's used in the methylation cycle that was addressed on the last slide that needs B12 to work. Okay, so if you can imagine, if B12 is not present, then this pathway cannot work. So we see an increase in methylmalonic acid. So this is actually a wonderful test to look at in addition to the serum B12 test, because it tells us exactly are the biochemical processes working in the body. Homocysteine is sort of paired with MMA, just another way of looking biochemically, are our cells getting enough B12 to do the things they need to do to make the energy? Holotranscobalamin is another one that can be used for looking at B12 deficiency, it's basically the chaperone protein that chaperones B12 around in the GI tract until it's ready to be taken up by the cells. And then lastly, we'll look at something known as a pernicious anemia screening. So when we see some of those abnormal blood tests, we want to make sure that it's not because of this autoimmune disorder that breaks down your body's ability to digest B12. And we look specifically at two markers known as intrinsic factor blocking antibodies and anti-parietal cell antibodies. So these are tests we can do here at Prosper with ease. It's just a simple blood test. And one of my favorites is looking at the B12 deficiency cascade, which means if your B12 is abnormal, then we check MMA. If the MMA is abnormal, then we check for the antibodies. So all of these tests kind of happen in a cascade if one of them comes back abnormal. So that's something that we can also run through insurance. Insurance can cover. And then another test we do here is our micronutrient test panel, which looks at B12.
Uh-oh, we might have lost her in a minute. I just heard thunder outside of my window too, so I'm wondering if that's what was going on. So I'll pick up from here until she comes back. So she's talking about the SpectraCells micronutrient test panel, and it's another way to look at our B12 levels. It's a more accurate way to assess those micronutrient levels in the blood. It also is going to look at several of the other, what we consider vitamin cofactors at the same time, and it gives us a really good idea looking at whole blood to figure out what's going on with these other vitamin and minerals that can affect absorption and the use of B12. So.
All right. So thank you, Dr. Molly. So next we're going to go into some of the things you might experience with B12 deficiency and what to look out for. So it's important to remember that you don't have to have, frankly, low levels on your blood work to start showing symptoms. Sometimes these symptoms can crop up when you're having more nuanced and minute deficiency in your B12 levels. So as Dr. Molly was explaining, B12 is really important for many different bodily processes, and it affects many different systems in our body. So it's going to affect the neurological system if it's not present in our blood to be involved in those enzyme reactions. So this can cause numbness and tingling in our hands and feet, sometimes difficulty with walking and balancing. And then other neurological symptoms we can see include memory loss, early dementia, disorientation, and brain fog. One of the main things that we'll notice with more progressed B12 deficiency is what we call megaloblastic anemia. So that's when there's not enough B12 to produce functional red blood cells, and our red blood cells start to decline, and they actually end up getting really large. So, they're basically larger and ineffective and are not able to divide properly. So we end up with less healthy functional red blood cells. This can cause symptoms really similar to iron deficiency anemia. So anemia just means less red blood cells. And you may remember that red blood cells are important for transporting oxygen around our body. And we need oxygen for so many different things. So when we don't have those red blood cells functioning and transporting that oxygen to our tissues, we'll often start to feel fatigued, not be able to exercise like we're normally able to, and many people will start to feel anxiety as well. Lastly, or second to last, we'll have, it'll affect the gastrointestinal system. So this is often because of it affects the cells that line our gastrointestinal system. You can experience tongue soreness and swelling of the tongue, and then also stomach inflammation. So that's largely because B12 is necessary to have a really strong intestinal barrier. So all of those cells that line our intestines are important for creating that interface that's really important between our gut lumen and the rest of our body. So the gut neurological system, the lymphocytes, and all of that. And so when we don't have that strong barrier in our intestinal system, we'll end up getting stomach inflammation. You can also have stomach inflammation in the actual stomach with a condition called pernicious anemia. And that is one in which it's actually an autoimmune condition in which your body starts attacking the cells that create something called intrinsic factor that's really important for absorbing B12. So some of the things that, stomach pain and inflammation in the stomach specifically is another thing to look out for that may be associated with B12 deficiency. Lastly, we'll look at high homocysteine. So as Dr. Molly was discussing in a couple of slides back, B12 is responsible for many different conversions in our body, in our bloodstream, and those are conversions on a molecular level. And one of those is transmitting homocysteine into methionine. And homocysteine, when you're not processing it regularly, it can build up in your system, and that's can lead to increased cardiovascular disease risk. So another reason why we're concerned about B12. So B12 deficiency is surprisingly prevalent across the world. Worldwide, it's estimated to be about 6% of the population that's B12 deficient. And interestingly, the prevalence increases with individuals over the age of 60. And we'll talk about why that is on the next slide, but it can actually increase from 10 to 19%, which is a significant jump. And another major population that we're concerned about B12 deficiency in is vegans and vegetarians. And we'll get more into these risk factors on the next slide. So one of the things to remember is it can take years for B12 deficiency to manifest symptoms. So often this is something that happens kind of in a slow way over time. So as I mentioned on the last slide, this B12 deficiency can double in prevalence for individuals as they age. And there's a number of reasons for this. One of the major reasons that we see in practice is a decline in gut function. So, we need all of our digestive acids and enzymes to be secreted to absorb B12 properly. A lot of our B12 is wrapped up in animal proteins, and we need hydrochloric acid to break down those animal proteins and release the B12 for us then to be able to absorb it. And one of the things that can happen with age is declining release of hydrochloric acid, declining gastrointestinal function, and this is thought to be one of the main reasons why the prevalence increases. We also see, again, as I was mentioning, we see this largely happening in people who are vegans and have plant-based diets. And this is particularly those who are not supplementing with B12. It's very possible to be a vegan or a vegetarian and supplement with B12 sufficiently. But it's important to be on top of that and aware of what type of supplementation your body needs if you are largely based on a plant-based diet. So another reason that can lead, or another thing that can cause the B12 deficiency is inflammation in the gut. So any condition that can impact your absorption in the stomach and the small and large intestine can impact B12 absorption. So we often think about this when people have things like food sensitivities or a dysbiosis that is affecting the proper function of the gut and the the contentedness or the integrity of that gastrointestinal lining. So that's something we always like to look at when B12 deficiency is present in our patients. So there's a few medications that can affect B12 absorption, and one of the major ones is proton pump inhibitors. So this is really common for people to take when they have gastritis or acid reflux disease. And it can be really important for some folks to take, but it does have its impacts on our digestive system and nutrient absorption. And so again, we need that hydrochloric acid to break down proteins that B12 is bound up in. And when you're not secreting enough of that stomach acid, that can impact the B12 absorption. So another thing to look out for. And then lastly, we want to look at a family history of anemia. Specifically with megaloblastic anemia, that was the one that I was mentioning is associated with B12 deficiency. And then we really want to think about that autoimmune condition, pernicious anemia, and there's certain tests that we can do to check for that.
It turns out that B12 is a water-soluble vitamin. So we're going to go through the biochemistry of how it's absorbed because we want to kind of show you some of these steps where things can go wrong, like what Dr. Mary was talking about on our prior slide. So one thing you'll notice when we look at this little cascade of how it's absorbed is at the very end here, it ends with this excess amount being secreted in the kidneys. And so what's important about that is that it's very unlikely to overdose on B12. It's considered a very safe supplement in regards to our vitamins because any excess is going to be transferred from the liver to the kidneys and out. So it's a really lovely vitamin in that regard because we don't have to worry about overdosing with it. We're more concerned about deficiency because it can be so disruptive to all these processes our body is supposed to be doing for us. Now, absorption of B12 is very complex, and it's one of the reasons why B12 is going to be more likely than many of our other vitamins to become deficient. So like what Dr. Mary was saying, up to 19% and people over 60 of these people are B12 deficient, have a B12 deficiency. And we see that because one of these steps is going wrong or multiple steps here. So what happens is the B12 comes in bound up in food. Within the salivary glands in our mouth and within our stomach, there's a substance called haptocorin, and it becomes bound to the B12. And that allows it to travel into the intestines. After that, we rely on our pancreatic enzymes to cleave, to take apart the haptocormin from the B12. And at that point, we rely on our parietal cells of our stomach. So we're still up in the upper GI in our stomach here. And we have these parietal cells releasing something called intrinsic factor. Intrinsic factor is like a chaperone that will help carry the B12 into the intestinal system and absorb it in. So into these capillaries in the blood of this portal circulation to go to the liver. So without the intrinsic factor being the bus or the transport shuttle system, we have a big problem that B12 won't go in. Now, so the intrinsic factor comes in, it takes it in through this distal ileum, and then that gets absorbed up into those capillary beds through the portal circulation to the liver. We also know that there's that substance, which we talked about in the testing slide, Dr. Rosalie had mentioned, of transcobalamin, and that being something that helps with the carrying of the B12 into the bloodstream itself. So there are so many complex structures here that are involved and enzymes to help break things down and cleave the B12 from the food that we're getting, that it's easy to see how one of these steps could go wrong, and then all of a sudden we have a deficiency. And we also know that some people genetically have a propensity to absorb differently their B12s. So there's these things called genetic polymorphisms. We shorthand that for SNPs. And we see this specifically on what we call the MTHFR enzyme, the methyl tetrahydrofolate reductase enzyme. And if we have a polymorphism that has changed our MTHFR enzyme system, then we may not be able to absorb certain forms of B12 well. And that's a big deal. Now, we know that there are at least 50 different types of mutations on that SNP itself of that gene. And so it can be really helpful in understanding if we have a familial set of vitamin B12 deficiencies. And also this helps us understand with our methylation pathway, that detoxification pathway, what might need to come in to help correct that for a patient that's suffering from not having those proper levels. Now, there are three main types of B12 that we want to talk about today. There's methylcobalamin, which many of you may have heard about, or methyl B12. We shorthand it, the cobalamin part, to just say B12. We have adenosylcobalamin and hydroxycobalamin. Now, adenylyl and hydroxy B12 are both mainly coming in our meats, okay, in diet. And the adenosyl is considered our active form, our hydroxy is considered an inactive form and needs a little bit of change before it can become active in the body. And then we have our methyl, which is a more commonly supplemented version. That's an active form, is generally found in dairy rather than meat. Now, this is a big deal for our vegan patients in particular. We have a lot of discussions around this. You know, how do we get our B12 in if we're not having meat or dairy in our diet? Also, for some of our vegetarians, it's another discussion that we're having. If they're getting it in the form of eggs or dairy, then they're getting more of that methyl version typically. We also have a synthetic version of B12, and this is important for us to alert our patients to, because many of them come in seeing us as new patients and they may say, oh, I've got my B12 covered. And we look at that little supplement bottle and we say, uh-oh, they've cheaped out here. This is the synthetic version. This is the cyanocobalamin version. And we don't generally recommend that as much for our patients. There are also injectables that are cyanocobalamin, so that's just another kind of no-no for our clinic. We're always trying to use those natural forms. So all of the above, all of the above as far as those three supplements, or three forms of B12 can be found in supplementary versions that are natural. So the methyl, the adenosine, and the hydroxy. And depending on your genetics, we might make a choice for a specific recommendation there.
So speaking of genetics, this is where we can test what your MTHFR status actually is. And this is something that doesn't require a blood test. It's just what's known as a buccal swab. So we just do a swab of the cheek, the inner cheek, and that gets analyzed in the lab and tells us what is the genetic SNP, or the polymorphism, for your body as an individual, and whether you're able to digest B12 normally, or whether you need a specific form of B12, like the active forms. This is a really wonderful test that I rely on for my patients who we just can't figure out what's going on with from neurological symptoms to GI stuff to like mental health to immune system, right? When it's like, we need to look actually at the genetics. This is when I run this test, because then it tells us, okay, yep, you're the type of patient who really cannot do any of the synthetic forms of B12. You need the methylcobalamin, because honestly, if you have a genetic SNP, you can't digest the other forms, and there's no way of knowing unless we're testing it. So I dove into the research, to see which type of B12 is best, and I found this article that kind of helps describe it. They report it in this article from 2017. The researchers reported that the natural forms of B12, be it methyl, hydroxy, or adenosine, are much preferred compared to the cyanocobalamin type, the cyano B12. Just in the literature, they found it much better absorbed, that raised your B12 status, whereas the cyano form just didn't perform. So it would be worth looking at your supplements when you get off this call to see what your multivitamin has, which kind of B12 is in there, because you might be thinking you're getting B12, but it's not actually being well absorbed.
Thank you, Dr. Rosalie. So fascinating. So next, we're going to talk about food sources of B12. And one of the things I find the most interesting about this vitamin is that it's synthesized only from bacteria and archaea. So even though animal meat and dairy and all of that that's the large source that we, the main source that we are able to consume it in, it's actually due to the bacteria in the gut of those animals that we're able to produce that B12, and therefore they absorb it and then we consume it through them. Very fascinating. So in humans, we actually do produce B12 in our gut bacteria, but it's in our large intestine, and we absorb B12 in our small intestine. So unfortunately, even though we produce B12, our bacteria do that for us. Very little of it is able to be used in our body. That's why we need it from outside sources typically. In ruminants, on the other hand, so cows and sheep, they are foregut fermenters. So they're able to absorb, well, their gut bacteria will actually produce the B12 in one of their stomachs, and then they can absorb it later in their intestines, which again, super fascinating to me. So on a daily basis, the major most easy sources from food outside of supplementation are animal sources. So we get it from animal meat, liver is a major source, fish and shellfish, eggs, and milk. And then some of the vegan sources that you can get kind of the highest dose from your food in are nutritional yeast, the Marmite yeasts and spreads from, originally made in Australia, and then algae. And then we've got fortified foods, so, fortified soy milk and oat milk and all of those things. And then fermented soy products is another way to, another form that you can get B12 in. And again, that's through the fermentation process and the production from the bacteria that are involved in making those fermented soy products. So when it comes to supplements, there's many different ways we can intake B12, and it's really important to think about, the way that you're likely to absorb B12 and to tailor your supplement form to that. And then, of course, you want to test your B12 levels and see how well it's working. So with in terms of oral options, we've got capsules. So those are really, great options for people who have really healthy gut function. And then we've got liquids. That is better if you do not absorb capsules very well. There have been some instances where my patients have gotten x-rays and you can see all of their capsules undigested in their intestines. So it's really important to think about, again, gut function. Am I absorbing this well? Sublingual is another option through lozenges, and in that system, you're able to absorb B12 in your into your bloodstream and through your lymphatic system directly. So it's another great way to consider getting it. Injectables is something that we do at the clinic, and this is a really great option if you have impaired oral absorption for any of the reasons we've discussed in the talk. You're taking proton pump inhibitors, you have decreased gut function, you don't have the cells that produce intrinsic factor, all of those reasons. And so we do the intramuscular B12 injections in the clinic. And you can also consider getting intravenous, so IV B12 and a couple of different combinations with other vitamins. Another really fascinating form of supplementation is an intranasal form where you would use a nasal spray. This is not very commonly used, but I think it's great because it's another way that you can directly absorb the B12 into your capillaries and into your cardiovascular system through your nose. And this is, it's just another way that you can bypass the gastrointestinal system if that is impacting your B12 absorption. So another thing to think about and talk with us about if you're concerned about that. All right. So here's another research study that was looking at which form of B12 is best absorbed. And this is pretty interesting. They actually found that between the intramuscular form or that injectable form that goes into your muscle and the oral B12, there were equal absorption. Now, the caveat here is that that's assuming that you have good gastrointestinal function. We've kind of hammered that point in. But assuming that you have good intestinal function, you should not have to do injectable B12. And that's important to remember that it is, for the majority of the population, oral supplementation is sufficient.
So Dr. Mary talks about oral B12, intramuscular B12. What about sublingual B12? And when we look at the research, from the last 2 decades, there's most of the articles just kind of come back and say, well, they're kind of all the same. And I was sort of disappointed by this finding and in our research here for this doc talk, because none of these articles that I looked at actually addressed what is the gut function of the individual, right? That's kind of an individualized study, right? What is the gut function? How well are their bodies producing hydrochloric acid, right? Is there leaky gut syndrome, right? Is there polymorphism, right? Is there MTHFR present? None of these studies, of these half dozen studies, actually went into that level of depth. And it's sort of my takeaway from looking at the primary literature is that for a healthy population, oral B12, sublingual B12, and intramuscular B12 have the same action and raise your levels in the same amount of time. And this, and I'll sort of drive this point home again, it ends up being an individualized decision. Whether a sublingual variety, an oral variety, or an intramuscular variety is what makes the most sense. If there's pernicious anemia, that type of autoimmune anemia where you just can't absorb B12, then intramuscular B12 is sort of the standard of care. We have to give B12 into the bloodstream directly. In my elderly patients, I would choose probably a sublingual B12 because over time, as we age, we know that the digestive tract and our ability to produce hydrochloric acid in the GI tract greatly diminishes. So oral B12 just wouldn't work quite as well for those populations. If someone has a genetic polymorphism on MTHFR, then again, it's a whole different ballgame what we end up recommending. So this was a really big learning moment for me in prepping for the doc talk. So diving into some more research here. This one's from 2020, and it talks about B12 as being really helpful for peripheral neuropathy, which is just a diagnostic term that means that there's a loss of sensation in the hands and feet, or maybe just the feet or just the hands. Basically, the peripheral parts of the body have either nerve pain or a loss of sensation. So in summary, B12 ends up being really helpful. There's a strong evidence base for B12 being helpful for this syndrome. From what's known as post-herpetic neuralgia, this is specifically with like shingles or any other herpes virus outbreaks. Alcohol-related neuropathy, because alcohol really diminishes your ability to absorb B12. Diabetic neuropathy, because sugar really inflames the system and destroys the nerves. B12 ends up being really helpful for all 3 of these types of neuropathies.
We also, in looking at the literature, found that when we're concerned about things like long haul COVID, so these post-viral infections, there have been studies now that look at how effective is B12 with supporting the recovery from these viruses. So this is one specifically that came back out in 2021, looking at people who are experiencing long COVID and how the supplementation of B12 has been helpful for them. So in this study, they looked at both methylcobalamin, that natural form of B12, and cyanocobalamin. They looked at them given in injectable forms as well as oral forms, and they found that there were benefits from these people who have taken B12 supplementation to help reduce some of these long hauler side effects, specifically in regards to pain, chronic pain management, and what they call the attenuation of neurologic symptoms. Well, what that means is the reduction of problems with their neurologic system. So that could involve neuropathies where we're having these pains or tingling or loss of nerve function. It could have to do with the clearness of our thoughts, like our mentation, and it could have to do with things like brain fog or even energy in regards to our neurologic symptoms. So this is a great tool for some of our patients who might be really suffering from some of these post-viral syndromes. And it's one that's so very low risk because, once again, it's very difficult to overdose on B12. Now, in regards to B12 supplements, there are several that we offer here at Prosper in our apothecary. They all have something slightly different to them. So there's reasons that we're recommending them for certain patients. We often will use a chewable that acts like a lozenge that's absorbed. And you see this in this active chewable B12. It's a methylfolate, it's a methyl version of B12, and it combines with folate, which is the natural version of folic acid, which many people may still call it folic acid, but this is folate, which is the natural version. And we do that a lot of times because B12 and folate deficiencies often go hand in hand, and we want to make sure that we're not missing one when we're providing the other. So we also will sometimes give a liquid B12. This is a methylated version of B12 that is also given, and then the patient holds it under their tongue for that sublingual absorption. Because remember, that takes out a lot of this lower GI tract's ability to need to break it down, that complex pathway the B12 has to travel through. We also sometimes will use something called MethylGuard Plus. Now, these are in capsule forms, but they also contain B6 and B5, and they contain some of that HCl to help with that breakdown of the B12. And this is more formulated for our cardiovascular patients, oftentimes, or our patients who are dealing with quite a bit of inflammation. And then sometimes we'll use something that's not on here called trifolamine, which provides all three forms of B12. So the adenosyl, the hydroxycobalamin, and the methylcobalamin, as well as the methylfolate, to ensure that we're covering the whole picture if we're still waiting for genetic testing, or if we know that multiple forms are going to be helpful for the patient for absorption. And those are given in little lozenges as well. And finally, we use these B12 injections. And although we know from the literature that if everything is healthy and normal, B12 given orally versus B12 injected should be the same. What we see clinically is a lot of our patients are coming to us with problems with the absorption of the B12 and these deficiencies in the first place. And it makes a huge difference to get boluses, big amounts of B12 into their bloodstream directly and cut off the need for those extra steps involved with an absorption. And that can really be a pretty quick turnaround with patients who do a series of these injections. So even after one or two injections, many of our patients are saying, whoa, that made a huge difference. So something to think about or discuss with your practitioner if you think that it might be relevant for you. Now, next month, we're going to be talking about post-viral syndromes. So things like long haulers with long haul COVID, for example. We're going to be talking about, so we're getting a lot of questions about this, like, why am I still feeling sick after I had this virus, whether it was 8 weeks ago or a year ago. So because this is coming up more and more, and we have more medical literature than we've ever had, more interest in this area than ever, we thought it'd be a good time to put together the most recent research for you guys and give you a little talk about it and help you understand that a little bit more. So understanding why we end up with post-viral illnesses and what we might be able to do to prevent some of those, and then what we can do if we find ourselves suffering from something like that. So we want to make sure that you guys have time for any questions. If you're welcome to put any of those in the chat right now if they've come up. We really love doing these talks, so it's a treat for us.
While folks are typing in questions, I just want to share a clinical piece that I noticed just in my practice in the past with these B12 shots. I had a patient who was coming in with like tremors and had been diagnosed with Parkinson's, and we did a month of B12 shots, and their tremors resolved. And so it's just sort of wild to think about how much B12 supports the nervous system, especially in a body that otherwise isn't absorbing it, and is thus manifesting neurologic symptoms. So just a clinical piece there, a story to send you home with.
To piggyback on that, making sure that we're getting annual labs done to at minimum look at our CBC. That's the one that is available on most of our annual panels and really looks at whether or not you're dealing with anemia. That's one of our first diagnostic criteria pieces that flags us to whether or not people have B12 deficiencies. So making sure that you're getting that screened for every year can be really a good preventative way to not go into a B12 deficiency or start to catch a trend of going towards it. So we've got a question about if we can print out the slides, and that is not a problem. You can just contact our office about that, and we'll have those available. Now, the recording will also be online, so we'll have that posted in the next week here. So you're welcome to go back and listen to the recording of the talk as well. And that'll be on our website at prospernaturalhealth.com underneath the little education tab. There's a whole bunch of our recorded talks on that, so you're welcome to peruse those. Well, we're going to sign off today. Got patients here this afternoon, and we really, really appreciate your time and hope you guys have a great beginning to your spring here.